Hi, welcome to Health Matters. My name is Sherry Gallant. I'm with Alberta Health Services. And today we're going to talk about a little introduction to home care. If anybody's ever been wondering what home care services are or how to get them, Sabrina Hansen is going to tell us all about it. Sabrina is a registered nurse. She's case manager with Lethbridge Home Care. Sabrina, what do home care services look like in the Lethbridge area?
Well, Lethbridge Home Care provides a variety of services within the home and in a clinic setting. We will assess clients to see what their personal care needs are. We try and keep them living independently in the home as long as possible because the ideal setting is the home as opposed to having to move into a facility, which is a new environment and it's very disruptive to the clients and to their families. So we do try and keep them home living. So we do a variety of personal care services, so things like getting ready in the morning, helping with baths. We set that up with some different agencies here in Lethbridge. We also will go into the homes and we'll do wound care. We will provide IV therapy services. We will assess them if they can't stay at home anymore, we will do an assessment to see what is the best type of facility for them. That's just a very quick snapshot of what we do. We refer to rehab, we work with the doctors, we work with palliative care. We are kind of just one small spoke in a large wheel.
Okay, so you're sort of their connection, not only to provide some care to meet their needs in their home, but also connection to other resources and help in the community.
Exactly.
Because you're sort of seeing them where they are.
Yes.
And be able to help them connect.
Yeah. And getting an idea of how are they doing in the home and is there anything that might benefit them? Would they benefit from some equipment that might help them to get into the bathtub on their own? Would they benefit from having that person come in to make sure they take their meds, to help them get dressed, those sort of things, just really trying to promote that independent living.
Are there any sort of misconceptions about what you do? Like, what are some of the things you don't do that people might think you do?
A lot of people, it would be ideal if we could do the housekeeping and the meal services. We are very limited in our ability to do that, unfortunately, at this time. In small amounts, we've been able to do that, but we do contract a lot of these personal care services out to other agencies. So us as the home care case managers or as the LPNs, we'll be doing more of the direct hands-on care, and the personal care, the things like getting them ready, getting into the bath, that would be going more through our contracted agencies.
Okay. You mentioned earlier that services can be provided through a clinic. Tell us where that clinic is and what services you can do there.
We are currently in the Lethbridge Center facility, which is right downtown just off of Scenic Drive, right beside the bay. We have a large what we call it an ambulatory clinic. There are several clinic rooms where we can provide IV therapy, wound care, catheter changes, different assessments. Our community rehab group will assess people for their needs in that setting as well. It is for our home care clients, and even though we do say home care, if someone is ambulatory and can come out, we would love for them to come down to our clinic because we can set times. We can do specific times for them, and it just works better for some people, especially if they are working, as opposed to trying to be home at a certain time. They can come on down to us.
Or if they have someplace they have to go, they can come in there for a specific thing. And ambulatory, does that just mean able to sort of move about or walk?
We do realize that some people, even though they are considered ambulatory, so they can walk, they are very limited in their stamina. Like they just don't have a lot of get up and go. We will still try and see them at the home, but if people can come out, if they are going out shopping regularly, we would ask that they come down to see us. We see people in wheelchairs, people who walk, walkers, canes, a variety of clients. And we do actually have a special room that was set up through the Chinook Regional Foundation where we have a bariatric bed and a lift so that should someone need a lift, we can actually use it. So we do have the ability to provide for a variety of clients.
That's terrific. How does someone access home care?
A client can refer themselves if they're looking for wound care, if they want to be assessed for personal care. All you have to do is contact our Access Center at 403-388-6380. That's our Access Center. They would be able to set you up for home care, and they would send you on to us.
And could a child call on behalf of a parent as well?
Absolutely. The only thing is, if the parent says no to whoever calls, That's their choice. They do get to say no.
Right.
But a child, a doctor, a friend, family, neighbor, anybody can call and make a referral.
An access center, that's the key word, is access.
Access, that's
Provides
right.
that access.
Yes.
Okay. I think we're going to put our website and that access number again on the screen. Is there anything else you wanted to say?
I don't think so.
Okay, super. Thank you for this.
Thank you.
And thank you very much for watching.